Good afternoon, it's Mark Larson. Sorry for the late video. So we are busy getting our variance. It's not really a variance. We are getting our application in for phase 3. We are meeting all of our metrics set by the state. My ask, and it's not a specific variance by the state, but is your county ready? So for us to be able to do this going forward, it requires a whole effort by all of us. For us to be able to open schools in the fall, for us to be able to have youth sports, we all have to work together to be able to do this. And moving into phase 3 is not a free-for-all that we can do whatever we want. It does allow larger groups to get together. So that's a really good thing, and it allows a few more people in restaurants and those type of things, but we still have to pay attention to the guidance so we can continue to move forward, because otherwise we'll be stuck where we're at, or potentially even move backwards. So, but that variance or that application will go in tomorrow. After the Board of Health signs that, it will go to the Secretary of Health's desk, and he will look at that, and I would expect to hear back first part of the week. Let's go to questions.
Is it possible to get a test if I don't have symptoms in order to be sure I'm safe to be around vulnerable family members and others?
It is possible, but it's not recommended. And that's because it's not really reassuring, because you would get a test, it would tell you that you don't have COVID right at that particular moment, but it doesn't tell you that you don't have COVID the next day. So that's one problem. The other problem is your insurance wouldn't pay for it. So it's still an expensive test, and so we are only recommending it for people who have symptoms or in specific circumstances, such as if people were out at a political rally of some kind and there was somebody at that rally that was positive, they should consider getting a test.
Why doesn't the county require that the supermarkets in Ellensburg require all of those who would enter them be wearing masks, especially during those hours designated for persons especially at risk?
So we like people to voluntarily comply with wearing masks. We can tell businesses that they have to wear masks. That was the governor's mandate. So, and that is enforced through labor and industry, and labor and industry have been in the upper county looking at businesses. So I know they're planning on enforcing those rules. We cannot enforce those rules on a business to say somebody has to wear a mask to go in a business. We could do that from a health officer standpoint. We could do that, but I think the buy-in would be pretty low. So we are not doing that currently.
Can a group of social distancing people meet at a central location and drive in their individual vehicles while following and abiding by the rules/laws of driving without requiring a permit to travel and/or safety plan when within close proximity to home? And then there's other questions about what are guidelines for close proximity and what are the restrictions of the same question above for phase 3?
Yeah, so in phase 3, it's still essential travel. So, and what's essential for one person is not going to be the same thing that's essential for others. So somebody might say, I'm going to travel from King County to Kittitas County to go camping. That is not really essential, but we're not going to arrest somebody for doing that. We're just asking people not to do that. So the part about driving in separate cars, that's a good idea. That would be okay in phase 2. In phase 3, you could get together with a group of 50 people or less and do that, but we'd rather not have you traveling long distances, because the counties around us have high rates of disease. Excuse me.
Bless you. Could you elaborate on the fact that so you mentioned that we will likely be in phase 3 in September. Could you elaborate on that? Why would we still be in phase 3 months from now?
Yeah, that's a great question. So there are no guidelines to moving out of phase 3. So the only thing is it's going to be at least 3 weeks. That's the incubation period of the disease plus some lag for getting lab results back. So that's where the 3 weeks comes from. but there have been no guidance in regards to moving into phase 4. So the feeling is that that's going to take a long time. Most epidemiologists would say it's going to be until we have a vaccine available. There's a lot that's unknown. So all I can really tell you is that at a minimum, it has to be 3 weeks, and we have no guidance in regards to how to move out of phase 3 to phase 4.
Now that the nursing home in town has been tested for COVID-19, will the residents and staff of assisted living facilities, aka Pacifica, Prestige, etc., be tested?
Yes. So that's the simple answer to that. President Trump made a mandate that all facilities are tested. They figured out how to do that in the nursing homes and memory care centers, and they're still trying to figure that out for long-term care facilities and adult family homes. So that will happen. Some of it is who's going to pay for the testing, those type of things, but I have not seen a date for that yet. And we do not have our results back from our current nursing home.
So we've received more than one question about the safety of having kids wear masks. There was also a question about safety for adults wearing masks for extended periods of time. Can you speak to the mask safety for both kids and adults?
Yeah, so there's a lot of data that are coming out of countries that masking is normal for them. So masking in places like Japan, South Korea, Singapore, it works to reduce spread of disease. So we look at the data from this particular outbreak, and we see that those countries where it's the norm for people to wear masks have decreased the incidence of the disease. So masking works. There is no data that says masking puts people at risk of getting disease. There's no data that shows that people's oxygen levels go down, that their CO2 levels go up, that it changes their immune system. The biggest issue really, and with kids and adults, is masking is uncomfortable. So it's going to be difficult for people to wear a mask all day long. It's going to be difficult for kids to wear a mask all day long, and that was the discussion that I was having with the Cle-Elum-Roslyn School District as we were just before coming in here, and I'll be going back to that discussion. So there's still more to come. There's no risk. They're uncomfortable, both for adults and kids, and we're going to have to figure that one out. So be kind to each other. Realize not everybody can wear a mask. We are putting our application in tomorrow to go into phase 3. We expect to get our application approved, and we'll talk to you tomorrow. Thanks a lot.